I'm Tom Stinchcombe. I'm a medical oncologist who specializes in thoracic oncology. I work at Duke Cancer Institute in Durham, North Carolina. So over the last 20 years, we've invested significant effort in developing new drugs to prevent chemotherapy, nausea, and vomiting, and as well as developing guidelines to really make sure that the new therapies, antiemetics, are incorporated into standard practice. In some ways, I think the computer injury system or the EPIC and the other medical record systems have sort of helped us standardize the antiemetic treatment for chemotherapy, nausea, vomiting. We sort of break this down to two categories. The first is what we call acute nausea and vomiting, which occurs in the first 24 hours. And then there's delayed nausea and vomiting that generally occurs 2 to 5 days after chemotherapy. We generally give medications IV to prevent nausea and vomiting in the infusion suite, and we're highly successful in preventing the immediate nausea and vomiting. The delayed nausea and vomiting can be a little bit more problematic. Many times we give medicines like dexamethasone, Zofran, or Compazine to take for several days after the chemotherapy. And I think we've improved this to such a degree that now about, I would say, 1 in 5 or 1 out of 3 patients experience nausea, and there's a lot fewer patients experiencing vomiting. I think our biggest concern is with the cisplatin-based chemotherapies, and that's why we're particularly making sure that the patients get the appropriate pre-medications, they get hydrated, and that they continue to hydrate afterwards, and take their preventative medicines when they go home. One thing that I found that's helped me and my patients is that we actually get them have the prescriptions filled before they start the chemotherapy. So if I would see them on a Tuesday, they would come back on next Thursday, and we ask that they bring the bottles in so that we can really say, you take this medication whether you're having nausea or vomiting, or this one in case you get nausea vomiting, you take this one for 3 days, and so that we're really trying to take care of this. We often use a medication called Zyprexa with the cisplatin-based chemotherapy, which is a psychiatry medicine, but has been shown benefit there. And so when some people pick up the prescription, they're a little alarmed that they're getting this medicine. So we make sure that we talk to them that this is really a proven entity in preventing nausea and vomiting. And so I think it takes a lot of education, and my nurse practitioner was the one who really came up with the idea that we should really have them bring the prescription bottles to our next clinic visit, and really sort of, and I credit her for this because we're getting a lot of errors and missed people taking in the dexamethasone too long, too short, and I think she's really implemented an improvement in how we communicate and educate our patients by making sure that the bottles are with them on the day they start the chemotherapy, and we can sometimes handwrite some notes and other things.